Welcome to another episode of This Week in Plymouth on the Road. I'm your host, Casey Kennedy, and with me today in Town Hall is Town Manager Derek Brindisi. Hello.
Hi, Casey. How are you?
I'm good. How are you?
Good. Great.
So today I wanted to touch on, a topic that has been pretty prevalent in the new year, that being the budget. So can you explain to me this year's budget and the challenges that we're currently facing?
Yeah, sure. So, Casey, as you know, I presented my recommendation to the Select Board back in early December for the FY27 budget. The board had about 3 to 4 weeks to review that. We had a follow-up meeting in early January where the board was a little concerned with my budget recommendation, given the fact that it only left $300,000 of excess capacity, which is something we can talk about. But that was concerning to the board, so they asked us to develop a second budget, or a second budget option, really, that allowed for a 1% cut to across each and every one of our departments. Then we brought that to the following meeting, which is about 2 weeks ago now, where the board went through each and every one of the department budgets. So every one of our department heads, fire chief, police chief, finance director, all presented their budget and their proposed 1% cut. And during the course of those deliberations, the board cut an additional about $170,000 out of the budget. So that leaves us now at the end of the budget recommendation period with $470,000 in excess capacity, where prior to that it was $300,000. I would say one of the concerning things from our board members regarding the budget is that 3 years ago, we had about $9 million in excess capacity. And excess capacity is basically taxes that weren't raised. So the town doesn't always have to raise the full 2.5% each and every year. And sometimes they don't. When we don't need the money, we don't raise it. And when we don't use the entire 2.5%, that extra goes into excess levy capacity. So, 3 years ago, we had $9 million, $10 million that we had never raised, which that was $10 million back to the taxpayer. But because of circumstances over the past 3 years, that $9 million excess capacity has been reduced to 300, and then the board brought it back up to 470,000.
Okay, so where did that money go when it gets reduced? So if you want to explain it to the community of...
Yeah, so basically when we look at our revenues every year, we get revenues from a lot of different sources. So the state provides revenue to the town. We're able, by Prop 2.5, we're able to raise taxes by 2.5%. So we can't go above 2.5% every year. And then we look at new growth. So we look at new construction, new building that's taken place in town, and we budget about $3 million each and every year for new growth. And then we look at local receipts, so building permits, what we're gaining for revenue through our various departments, and we budget about $2.8 million. So we put that all together, 2.5% new growth and local receipts. We came up this year at the first revenue pass at $11.5 million. And so we needed to use the 2.5%, but the problem was this past year, $11.5 million in new revenue was not going to be enough. So that's why we had to take an additional $1.7 million from the excess levy capacity to apply that towards the budget so that we could have a balanced budget.
So just from an outsider looking in, if I'm just a community member, $11 million in revenue sounds great. Where is the issue coming where it's not balancing itself out?
Yeah, so that's a great question. So I would say one of the major budget drivers this past year was our healthcare costs. So our healthcare costs alone went up $5.5 million. So think about it for a minute. If you only have $11.5 million in new revenue, $5.5 million is just health insurance, and then we have, by law, we have to require to pay our pension obligations, which is another $2 million. So 5.5 of healthcare costs, $2 million in pension, we only have $4 million left over. So that means we have to split the budget with the schools. So that's not just the town. We have to send 60% of that $4 million goes to the schools, and the other 40% stays here with the town. And that's ensuring that we have fire, police services, public works services, town hall services, health and human services. All of those components of the services we deliver each and every year would have to be balanced on less than $4 million. So that has been the major conversation this year regarding the budget. And quite frankly, if we don't control our healthcare costs, we're going to be in a much poorer condition next year than we are this year.
Yeah, it's definitely scary to think about. Because we're talking about fiscal year 27, so we're obviously going to be going into that in July 1st, I believe.
That's right, yeah.
So I know you had made some statements previously talking about fiscal year 26 and saying we were in a good state. And I know per the last select board, a lot of people were saying, like, how did we not see this coming? That's not really accurate. We did see this coming. We can forecast for the future to the best of our ability, but there's always going to be stuff that pops up like the healthcare and health insurance.
Yeah.
So maybe based on the comments that you've said in the past about maybe not seeing an override in the future, can we just speak on that a little bit?
Yeah, so when I made my comments April of 2025, so I was referencing the FY26 budget, and I think I had made a comment that, we really would not be concerned about having an override conversation for years to come. And that was because at the time, we had a lot of protective factors built into the budget. I mentioned one already, the $2 million of excess capacity. We had other line items such as the nuclear stabilization account or the facility stabilization account that accounted for $1 million as well as another protective factor. We have invested almost $6 million a year in roads. So we had money in roads that if we had to reduce. So when you look at the budget in its totality and you look at all the protective factors I just mentioned, even if you were off a little bit, and what I mean off a little bit is like $1 million. If you're down in revenue by $1 million, you have all the protective factors that you can cover that gap. What caught us off guard was health insurance, right? So think about, when each and every year you have to renew your car insurance premium, right? You call up your agent and say, listen, I want to renew for the next year, and then they hit you with a 15% increase. You're thinking, how come I didn't know about this, right? But you have the ability to shop that around. You can say, listen, I don't want a 15% increase. Shop that around for me. Try to find something a little bit less expensive. We don't have that ability to do that with healthcare costs, right? So we try to project based upon claims, medical claims that were made, what our costs are going to be. And then when we sit down with the actual health insurance company, they tell us what the actual number is. And so this year, our costs have gone up by like 14%. And there are some reasons. So that Ozempic drug that a lot of folks are using for weight loss.
Yeah, the GLP-1.
The GLP-1 drug, that alone is worth $3.5 million in this year's budget. So those are all unexpected trends that we weren't forecasting a year ago. And quite frankly, it's almost impossible to forecast that far back what your healthcare costs will be in 12 months from now.
Is there a way that we can work with, our healthcare agencies to mitigate these costs? I believe Blue Cross is now no longer covering the GLP-1s, but that will be, after our budget year begins, I believe is kind of where we're hitting an overlap, or am I wrong about that?
No, so the GLP-1 is going away effectively July 1st.
Unless you need it for...
Right, for let's say you're diagnosed with diabetes. So those individuals still have access to that drug. But on our formulary, in and of itself, the drug's going away. So we know we'll have significant savings there. But we can't make any changes to our health care plan without the union support. So we have a 5-year agreement with the unions that takes us out to 2029 that we had just signed a few years ago. And I do have to say, though, when we negotiated that health insurance compact, we saved approximately $5-6 million in the first 3 years. So there was a lot of benefit from that original health care plan that we had negotiated a few years ago. But again, there's a lot of things that have changed, in the last 3+ years. So we'd love to work with our unions again, sit down, reopen that healthcare contract, and look at ways that we can jointly save money.
Yeah, no, and it's a great point for folks at home to remember is we can do our best here in Town Hall to predict the future, but working with outside vendors and outside partners, there's obviously, based on the economy, things that are going to shift that we can't necessarily predict. And like you said, we signed a contract with the unions, 5-year contract, at least 2 or 3 years ago, so we got a few more years left.
But think about this for a second, Casey. Like so this year we're talking about healthcare costs. Last year, what was a big conversation about costs, right, to our residents and taxpayers? It was energy, right? And we had multiple forums just to talk about electricity, right? And then 3 years ago, right at the end of COVID, gasoline was, very, very expensive, to the point where, we were budgeting almost twice as much in our fuel line item than we ever had before. And so again, there are items that are beyond our control, right? We don't control energy costs, we don't control fuel costs, and we don't control healthcare costs. And there's been a report issued by the Boston Globe, I think it was recently, that speaks to the problem in Massachusetts alone regarding healthcare and the rising cost of healthcare. And it has to do with, the hospitals, union contracts with nurses, the physicians and the costs that they incur, in providing healthcare. So all of that, someone has to pay all those bills, right? So those get passed on to the end user, and that's us.
Yep. And I'm glad you touched on that this is not just a Plymouth issue. This is happening throughout the Commonwealth. I've been talking to people in other towns, and everyone kind of thinks it's only happening in their town until they kind of hear otherwise. So we're not alone in this. It's not something that's going to be tackled overnight, but everyone is doing their due diligence to make sure, residents don't lose the much needed services that we offer here in town. So where do we go from here? What do you want to leave residents with while this budget is going to town meeting?
So at the FY28 budget, which would be next year's budget, is my number one priority right now. We can talk about fire and police service and DPW services all day long and economic development, but unless we have a strong, viable budget, none of that stuff matters. So, I'm focusing my energy working with the select board and others so that we can try to understand some cost controls, and we can implement those, because what we don't want to do is we refuse to cut services, and we know that if we can't control the healthcare costs, and ultimately what that is going to amount to in the summer of 27 will be cuts to services, and we don't want that.
Yeah, and you're talking about summer of 2027, because I know the fiscal years and the years get a little tricky when we're talking budgets. But again, you did touch on, you think you said the Boston Globe did an article. So I know the Massachusetts Municipal Association also shared a report that I will be putting on the website that explains how this is affecting municipalities throughout the Commonwealth for anyone that wants to read it, that it's not just silos here in Plymouth. But before we wrap up, is there anything else you want residents, the Plymouth community to know? Just
that, we are paying close attention to this. We are working with our healthcare consultants and others to try to figure out a way to balance the budget, moving forward. But, as you pointed out, this isn't a town problem. This isn't a union problem. This is a collective problem that we have to address. And so, we'll be working with our state delegation to determine, what resources that they have that they can bring to bear. I mean, at the end of the day, we want to make sure that we provide, highly efficient and effective cost-saving services to all of our residents. Which we all appreciate, I'm sure. And thank you for all the hard work and for taking the time to join us today on another episode of This Week in Plymouth on the Road. We'll see you next time.